Jamie Simmons from Covantix. I want to take a few minutes to explain our core modeling entity. It's called services. A service can be anything from behavioral health to non-emergent services to an Uber model. It's really up to the client, the doctor, the clinic, or the hospital to define these services. But we use the services entity to bind companies, patients, doctors, hospitals, and clinics all together. And so taking a look at this diagram and imagining there's a managing entity up here, you have a number of hospitals or clinics that might be managed by that. On both sides, it shows hospitals. Following down this side, a hospital or clinic has many provider networks, which is basically doctors, an arbitrary collection of healthcare providers, and of course they have patients as well. And so what happens is that we'll define these set of services, and these doctors that are potentially grouped into provider networks subscribe to those services. And then on the other side, patients come in and they're offered plans and plan options. And these plan options each have a service or one or more services linked to them. So anytime a patient comes in and asks for example, a non-emergent consult, that service is then subscribed to by a specific doctor or groups of doctors. So only that doctor would see that patient request for a non-emergent service. And that's basically how we bind things in. We'll create plans and plan options. And the plan options subscribe to services on one side, and patients then choose their plans or plan options. Then on the other side, you'll have doctors. HCP is short for healthcare professional. They can be grouped into provider networks, and you can set services for an entire provider network or individually. And then, of course, hospitals manage these provider networks, and then potentially they're managed by another entity up here which controls these services. And that's basically generally how services work. Thanks.